microphones if you're joining. Thank you. That's great. I'm joined today by Leanne, who's going to take us through a briefing, and Sonia Chuck, who's going to go back through the systems of control with us. Please can you listen to Leanne whilst she's giving you the briefing and take in what she's saying. Listen to all of the briefing, and then if you put questions in the chat as normal, we'll do our best to answer them as we go on. Any that we can't answer immediately, we'll come back to you with the answers for. And I think that's everybody in. I think we'll get started. Sonia, are you there? Because you're going first. Sonia, can you hear me?
I can jump in while we wait for Sonia to join.
Okay, yeah, we'll do that. So I'm going to hand over to Leanne, and Leanne is going to provide you with your briefing this afternoon. I'm going to go over to the chat and to start managing the questions. Thanks, Leanne.
Hi all. So just to kind of quickly take everyone through the data for this week for a start, just to kind of get the context of what we're working to. So just bear with me 1 second as I share my screen. So hopefully everyone can see that, or do shout out if you can't see it. I'll just put into presentation mode. Bear with me, just take a minute, well not a whole minute, but a few seconds to kind of load that up as it thinks about it. So ultimately this is to give you an idea of what's happening with cases across Warwickshire. I know obviously we have a lot of anxiety on the news, we hear about the number of cases, and it's good to know what's happening in your area. So this is wave 2 and 3, as I'm calling it, because we were expecting after Christmas for things to quite continue on a downward trend. But obviously we have seen a massive peak, in the highest peak we've seen to date over the December to January period. So best laid plans, eh? So ultimately what we're seeing in the last day or so is we've come down to a 7-day rolling average. We use a 7-day rolling average because it gets rid of all those peaks and troughs. It kind of smooths it out. So we've got about 117, which if you look across the data, if you drew a line at 117, you would see that that probably aligns to late October, early November, which is around the same time we were in the half term, sort of between October to Christmas. So we're actually seeing similar cases to what we were seeing back then. And obviously a few months after that, we had a lockdown. So after each lockdown, we are seeing the impacts of the lockdown. Every single lockdown has brought the numbers down, which we've been really happy to see. And that is true also for this lockdown. And that's why it's been sustained and why it's been lengthened, this particular lockdown, compared to the one in November, is because this lockdown has had to come from a higher peak. So we're now where we were, as I say, towards the end of October. Now, the situation we were in October was we didn't have LFT testing in the community, so we didn't have the 30-minute rapid testing, and people were generally only going for PCR tests if they had the top 3 symptoms. So we have been doing since early October a lot more testing in Warwickshire in our schools, and obviously since sort of the end of December, early January, now every district in the county have got an LFT testing centre, so those that wish to go and get screened without symptoms can go and get tested. So that's good to see. Now we've got the 5 districts and boroughs here. So as you can see across those 5 districts and boroughs, the highest area now is Rugby. Now these numbers were, the very last table, the one that says 7-day rolling average, these numbers were broaching around sort of 350 up to 400, 420 in some areas. So as you can see, compared to where we were, these have massively come down. The highest area is Nuneaton and Bedworth, is Rugby, followed by Nuneaton and Bedworth, and then North Warwickshire. The highest number of cases are in Nuneaton and Bedworth, followed by Rugby, and then Warwick. So so we have seen cases come down, which is brilliant. Now, in the county, across the areas which have the top 5 wards, the highest now is Ben, in rugby, Poplar in Nuneaton and Bedworth, Newbold in Rugby, Leamington Wells in Warwick, and Slough in Nuneaton and Bedworth. Now, these wards were seeing originally cases around 100 or over 100, so it's good to see that they've come down to sort of 69, 66, 60 and 52, which is brilliant to see those numbers are coming down. And the reason why this is coming down is because sites like yourselves in early years, our primary schools, our secondary schools, are all responding to cases and preventing onward transmission with all the various tools that we've got. So I have to say, you know, when you're seeing these numbers coming down, be aware that you have played a part in this, a massive part in this, to bring those numbers down. So just talking through some of the issues that we've seen recently, and some of the advice and guidance. So the first one is the isolation period. The isolation period is 10 days. Now, there's obviously some confusion around how we count those 10 days. So the day of exposure, so if you're a close contact and need to isolate for 10 days, your day of exposure is the day that you were in contact with a person. It wasn't the date on which they tested or the date in which they got the test results. It was the date in which you were in contact with them. And that day is classed as day 0. And then the day after is day 1. The reason being is you can't class it as 1 because you've just had that exposure. You haven't had a previous history. You've only just had that exposure. So we class the day of the exposure as day 0, and then we count 10 days from there. So if it was the 8th, you would isolate from the 8th to the 18th, returning back to regular activity on the 19th. And that's what we need to put in our letters to families to let them know about isolation periods. One issue which was raised last week, which was around the family isolations. So just to run you guys through that again. So if you have a mum, dad and a child that lives in a home, and mum develops symptoms and tests positive, and then the whole household isolate for 10 days, the whole household isolates for 10 days from the first person developing symptoms, and that is the date that we go from is the first person in the household developing symptoms. If anyone else in those 10 days then develops symptoms and tests positive, then we don't reset the whole house and start them all again from the next person and the next person. We still go from that first person in the household who develops symptoms. So that's how we deal with a household situation. The first person, we go from their symptoms. If anyone tests positive and then goes on to develop symptoms, we don't go from the test date. We have to go from the symptoms date. So if anyone did not have symptoms, tested positive, and then later developed symptoms, we have to start the clock again, and we have to start the 10 days from when the first person developed symptoms. That's the only thing that has a bit of a nuance there. So ultimately, when would you start to isolate after that? So if a family have completed sort of 10, 14 days of isolation, and then a family member who hasn't tested positive then goes on to become unwell and test positive. So after about sort of 10 to 14 days, we would then consider isolating them all and bringing them all back to isolation again. But if you ever have that circumstance happen, please contact me, Leanne Brooksmith at warwickshire.gov.uk, and we can discuss that through if ever that happens to you. It's very rare that it happens. Now, if you have tested positive for COVID by PCR, which is the polymerase chain reaction way of testing, what they do is they take a swab, and then that sample is taken to a lab and they break it down to the genetics in that swab for a PCR test. So if you've tested positive, then it is likely that for up to about 90 days, you can continue to test positive. The reason being is that there's dead virus in the nose. Now, the LFT test, it works differently. So the LFT test binds to receptors on the surface of the virus, and therefore the virus generally has to be alive for that bonding to happen. It's a bit like a wilting flower. It won't bond, or because you can see that the receptors dying, and so you won't get the same level of bonding. So in some circumstances, when you've tested positive for PCR, the PHE guidance in adult settings has been to not worry about LFT testing for up to 90 days. However, the DFE guidance is very clear that even if you've tested positive by PCR, they want you to LFT test if that is part of the nursery ritual, and that can be done via the LFT testing centres. However, just be aware that to LFT test, not to PCR, because if you PCR, you can PCR positive, as I say, for up to 90 days. So you can use the LFT testing, but I would recommend that you don't PCR, because that will create confusion, because it is likely you're going to get another positive test. Then if we just go on to control measures, we're still having quite a few settings that are having issues with the overlaps between groups. So we need your groups, and we used to refer to things as like bubbles, but they're now called groups. So if I accidentally slip into calling them bubbles, I actually do definitely mean groups. So if ever you get to a situation whereby you have a group and a case, and then in another group you have another case, we do query of whether there's been some kind of seepage between the two groups, or that one of your groups has burst in the sense that it hasn't been able to keep itself contained. Where you can, do keep your groups apart, and by that we mean the staff who hand over between the groups, where you can, make sure that only those in that group receive the children from that group, and only those who are in that group give that child away back to the parents. You can ask parents to wear face coverings at the entrance to the door if you wish, to make sure that when you do those handovers, the transmission has a lower chance of transmission by having face coverings. If you wish to do that, that is your business, and if you want to add that in, you can. The use of toys whereby they're not easy to clean, we would recommend only using toys that are easy to clean, and not moving toys between different groups unless they've had like a good gap of at least 72 hours before groups and they have been cleaned very, very deeply. So it's just, while we're in this last push, as it's coming down, we just don't want to become complacent. The reason why it's coming down is because all of you are working so hard on your control measures. Because the cases are coming down does not mean it's a time to relax. It's a time to see that your hard work has paid off, but let's not give up. Let's keep going. Once COVID does get into a setting, we find that, all the right control measures prevent it going from group to group. And we just need to bear that in mind going forward. The early years advisors team are now sending out a checklist. So just to give you a heads up of what the checklist is. So we're having a lot more cases in nurseries than what we'd seen previously. I think the reason being is that the cases had massively increased. And as a result, some of the families and some of the children that hadn't been exposed before have been exposed. And so because we have so many early year settings and childminders and nursery settings and other types of childcare, we haven't been able to create a scenario whereby we feel that we've had the chance to speak to every single one of you, because there are so many. So when you have a case, you have to report it to the WCC reporting form so we can see it's there. However, sometimes on that list is on the list is to call DFE and let them know. But sometimes DFE will say, OK, you've done all your actions now. Don't worry. There's nothing further to do. But there is, because you need to contact us at WCC. So that's why we had the WCC reporting form. If you get another case, you add that again to the WCC reporting form. But what you might find is that what you will find is that the early years team will contact you with a checklist. And what it will say is, when you get cases over a couple, can you fill that in so that I can have a conversation with you and I can work out what's going on at your site. So it may be the fact that you've had one case, you sent the group off to isolate, and then there's a further case who's been a close contact, but nothing further happens. That's fine. And that's kind of what we expect, is that you send them off to self-isolate, you may get a case, and that's fine. I'm not going to be able to tell the difference on the reporting form necessarily between that and when you've got two cases in two separate groups, but there may be links and there may be a sign that this is going to become an outbreak. So do use that checklist to fill in, especially the first page, on describing what's happening in your setting, and I can then use that to risk assess what's going on. Later on, the later pages are more prompts for you. So things to consider around cleaning, things to consider around uses of toys and other things in the setting, and just how you have the overlap with staff. So although it seems like a very long form for you to fill in, actually the later bits are really just a prompt to make sure that you're following all the best guidance. And it just saves us the time of taking you through all of those steps. And obviously the main thing to do right now is lots of deep cleaning, especially contact points and touch points, and always use sort of a hypochlorite based cleaner where you can, because that's the best thing. Lots of settings are also doing fogging. that there is no evidence at this time that that is any better than a good deep clean, and more so there's no point using fogging and not deep cleaning, because what that does is it puts an antiviral on the surfaces, but if the surfaces are dirty, it's not going to penetrate through to make sure that the surface is clean. So we do obviously think that that cleaning is the best. Now, I know a lot of you are really frustrated about the lack of home test kits and test kits for you and your workplaces. I am equally as frustrated, as is the early years team. I have put more sort of emails out and noise up to DFE to say, you know, why are we not getting test kits for more early year settings, or a way that you can collect it? And the team are working really hard to advocate on your behalf to try and get home test kits. But unfortunately, we're just not able to get those at this time. We do know that there's guidance that if you have over 50 in your workplace, then you can apply for the government to get LFT tests. Now, I don't know how it works, the exact details, but if I was in your type of business, I would look at, you know, if you are a group of nurseries as part of a, you know, a big chain of businesses, whether you could apply for all of you to get it as part of one big workplace rather than an individual. And I'd say, you know, anything like that, you know, try and apply to get under those rules, to understand how you can get access to those test kits. So I would recommend that. Also, if you're in an area that isn't well served for distance for an LFT test or for PCR testing, it's worth potentially, and this is for an informal agreement, whether if you are a feeder nursery into, say, a local primary that has local siblings, so you know that your siblings that are from your setting, you know, do link into that setting, whether they are good enough to potentially share with you some of their provision of test kits. I don't know how possible that is, but I'm just trying to open ideas, because if they are able to order the test kits on your behalf and include you into those numbers, that would be really helpful, but I don't know how that works. So when there are situations whereby people do need, you know, these test kits, we are looking at some creative solutions. But as you know, you can access the community testing for LFT, which is when you don't have any symptoms. You're supposed to go when you don't have symptoms. Don't go to an LFT test centre if you're self-isolating. If you have got symptoms, or if you are isolating and you want to go and get tested or screened, you can go for PCR tests and book those online. What you state is that it says, do you have symptoms? And if you don't have symptoms, you say no. And later on the screen will say, why do you want to get a test? And you say, I want to get a test because public health had advised me to test. And you can get access to a PCR test. As I've mentioned, if you've previously tested positive, don't PCR test again within 90 days. But your DFE guidance does state that you can and should LFT test following your nursery guidance or childcare guidance going forward. So you use an LFT test when you don't have symptoms and when you're not isolating, and you use a PCR test if you have symptoms, especially the top 3. That guidance has not changed. If you're unwell, really, you sort of go to get a PCR test. And also if you're isolating, you shouldn't go to an LFT centre, but you can go to a PCR test. In some of your settings, when there have been outbreaks, and by that we say about 3 cases in the same group, we are now asking for the group to LFT test before they come back. Obviously not those that have previously tested positive, they complete their 10-day isolation and then they come back. But those who haven't tested positive, and we know that there has been transmission within that group, we are now asking parents to LFT test. There has previously been massive pushback. So around the September, October, some of November, we have had pushback on some of that. However, now we're finding that more and more parents are actually quite relieved that you're asking everybody to test before they return. So lots of parents really do like that they're being asked to test. As I've said before, when they're really little babies, so if they're under 2, they can be very difficult to test. So what you can do is remind the parents to place the finger over the nostril and do the swab, because otherwise you kind of feel that you're just pushing the swab up into the nose and you're worried about how far it could go up. Also, obviously, little children do wriggle. So placing the finger on the nose means you can do the twisting swab as easy as possible. If they are finding it very difficult to swab the child, we would always go that they try and swab the child in this situation. But when they can't, what we advocate for is that they swab the entire family, and we use that as a proxy for the child, that if the entire family is negative by LFT, then the child is likely to be negative by LFT, and we can use that as a proxy. In most cases, families are quite happy to get their child to be tested, and they actually are relieved to get that result. But obviously, you know, everyone has different types of communities that use their settings. So I do apologise if you are having a very difficult time of getting testing done. And we have got obviously some nuances around that. So that's the main things at the minute. I'll just have a look in the chat box to see if there's been any questions. Thank you so much, Amanda and Sonia, for dropping stuff into the pages. So we don't need to go back to the contacts for the past 2 days anymore. Yes, so if you test positive on the day that you tested positive, you could have been infectious on the 2 whole days before. So if I test positive on a Friday, I could have been infectious on the Thursday and the Wednesday. So we would include all people who are a close contact within that period. The issue being is when we count the close contact isolation period, it starts from the last contact with that person. So if that person was with them on the Thursday and the Friday, we would include the last time they were in contact with that person, and we would count from the Friday. If you met that person, they were positive on the Friday, you'd include all the people with them on the Thursday, you include all the people with them on the Wednesday. If there was one person on that Wednesday who hadn't been with them in the later days, you would say to that person on the Wednesday, you isolate from that Wednesday for 10 days. So if I use the dates wise, just so I don't cause confusion, if you tested positive on the 5th of February, you would include everyone from Thursday the 4th and Wednesday the 3rd. If the person who was with them on Wednesday the 3rd was not with them again, that was their last contact with a positive, that person would isolate from the 3rd to the 13th, going back to regular activity on the 14th. If there was someone with them on the Thursday but not the Friday, they would isolate from the Thursday the 4th to the 14th, going back to regular activity the 15th. And if it was on the Friday that they were last with that person, on the day that they tested positive, then it would be from the 5th to the 15th, for going back to regular activity on the 16th. And obviously I'm using the term testing positive in the same way as I would say if they'd developed symptoms and tested positive later, because we go from either 2 things. One is if they test positive but without symptoms, we use the 48 hours before then, or if they test positive and they had symptoms before then, we go from the symptoms, when the symptoms start, and we use the 48 hours before that. I hope that makes sense, because that actually sounds like a bit of rambling. But in the chat box now, we've got the web pages. That explains a lot why you're getting different advice. So in the thing, we've got the web pages, which is great for Sonia and Amanda put that in. Yes, the close contact guidance can be found there. So if you want to read it through after I've explained it, it's there. They will be put in the checklist. So the checklist I described, that long checklist, will be available on the website. So it just really helps with our issues around risk assessing what's going on in your site. If you have had quite a few cases and you are worried, don't wait for us to contact you. Contact the early years team and say, look, I'm worried. Can someone give me some advice? So please do approach us. It's very complicated to set up a workplace test centre, and one set of guidance is 49 pages, many documents to read through. So if anyone wants to set up a workplace test centre, please do approach the early years team and me. In the council, we have a lead who helps the community test centres be set up, and they have been round the school test centres and they've reviewed them and audited them just to give them some helpful hints and guidance. And actually the schools have been very happy for that advice and support. So if you did want to set up, if you were a workplace that could group together with others to make that number of 50 and get access to the LFT testing, then please do let me know and we can provide some advice and guidance. So we're exploring every option. Yeah, so that's right, Amanda, we are exploring everything we can to get LFT tests. And returning to the setting from isolation, is it the LFT we should ask parents to do? So yes, if you've had an outbreak at your setting and it's likely that there's been transmission to the children, you have a better, you have more children that do carry the virus asymptomatically. Lots of people will carry the virus, they're not more infectious than anyone else, but I do find that the children are more likely to have the lesser symptoms. And so in that group where I think it's more the fact that they can't tell you that they're feeling unwell in themselves. Sometimes they're just a bit grumpy and you wouldn't know that they were unwell. I think that's probably more the issue, because actually I think when you are an adult, you can say, I've got a bit of a headache today, I just feel really unwell. Whereas a child is less likely to say that. They're more easily distracted by things and still seem quite well in themselves, even though they're not. So if you have had transmission in a group, I would recommend that when everyone comes back to the setting, that they have all had an LFT the day after they've come out of isolation. So they're due to come out of isolation, say on a Thursday. As they're due to come back into that setting, I would not allow them back in until they've had an LFT test in that morning. Now, your businesses are your private businesses. This is my advice and guidance. You don't have to follow my advice and guidance, but I would recommend that they go and get a lateral flow test as they're due to come back into the setting, just so you know that they haven't got it and they're not carrying it. And like I say, it can be quite difficult to get really small children to be tested. You'd be amazed at how many parents will do it though, without any problems or any noise. But if they are struggling and they aren't able to get a decent test, or if it keeps coming back inconclusive, for example, then we are happy to accept the wider family getting a test as a proxy, but we would rather the child to get tested. Do you have updates on vaccinations for early years teachers, or any ideas about how we can push for this? At the minute, the only people who can get vaccinations are those that are working in personal care with those who are clinically extremely vulnerable, so or clinically vulnerable. So if you do have staff that are clinically are working with clinically vulnerable children, then please do contact me. I'll put my email in the chat box in a minute. So if you have staff working with clinically vulnerable children, then please do contact me and I'll advocate for them to get access to vaccine. But at the minute, it's only staff that are working with clinically vulnerable children, unfortunately. But obviously, as we go down the various checklists of people, it may be the fact that many of your staff will get access to it based on their own vulnerability criteria or age, and they can get access that way potentially. So do you have any updates on vaccination? And I'm always pushing for you on the lateral flow tests, always pushing for you on the vaccine. So where I can, obviously I'll get as many things to you as possible. Then next question, sorry. Just a school calling me. What is classed as clinically vulnerable cystic fibrosis? Contact me if you've got children who have conditions like that, and I will check through what the clinically vulnerable is. I don't know if that particular condition is on the list. I think it is, but do contact me, and my email's there, Leanne Brooks-Smith. Thank you very much, Amanda. It's like Blue Peter. Here's what I've done before. So thank you very much. I think that's all the questions. We are lateral flow testing only once per week, as we're asking staff to travel and take the test in their own time. Do we need to require 2 per week, or is 1 acceptable? The guidance, as far as I'm aware, is to have 2 per week. However, I think that line is just guidance. I will have to go away and double check that, because I'm not sure what's the difference between early years and primary school or secondary school on that one. Because you're not being provided the tests, I would imagine that once is absolutely fine if you can't get access to it. And that's another reason why you need the home test kits, isn't it, really? But yes, as far as I'm aware, you're fine with having it just the once. Do you have any data on positive cases in early year settings? I probably from next week I can start presenting some data on just the early year settings cases. We've only started, well, we've had data for some time, but we've only really started putting it in a presentable format recently. But Sarah, I will do my best to get that ready for next week to discuss that. Yeah, it's monitored, but it's just making sure it's in a presentable format that is usable in this realm. But that's it. And that's DFE data. So I'll have a look at that because I haven't examined that closely myself. So I'll stop sharing. I think I've stopped sharing my screen. I think it's over to Sonia.
Sorry, I was on mute and I couldn't unmute myself. Can you all hear me? Somebody just say yes.
Yes,
Yes.
I can hear you,
Yes.
Sonia.
Okay, I'm going to leave my camera off because the connection's a bit weak. Thanks ever so much, Leanne, and really big thank you for flagging up that importance of continuing to follow that system of controls. I just wanted to flag up that actions for early years and childcare has been updated. So there's 2 new pieces of documentation that go with that. We will put it in the briefing tomorrow, and I put it on our Facebook page today as well. There's education and childcare settings national lockdown from January, 5th of January. That really just stresses again the importance of following that system of controls that's set out in full in actions for early years and childcare. And then they very helpfully separated off the what to do if a child or adult is displaying symptoms or is a confirmed case of coronavirus in an early year setting. And there's a bit in there which actually advises you now to contact your local public health, which is Leanne. She is our public health face. And if you've got 2 or more cases, so again, as Leanne said, contact us in early years using the early years advisor email. We can help you as much as we can, but if it's a bit more complicated, then we would signpost you to Leanne. So it really is just to reiterate that we are there for you. There's also, I've put in the chat, the updated risk assessment. Again, really, really useful to go back and have a look at that. I know that a lot of you have used it. We've updated it in line with all the changes that have happened due to national lockdown. And again, you know, we're putting information on the early years web pages. We always try and keep you up to date with what we're putting on there by putting it on Facebook as well. And it will go in the briefing on a regular basis on a Wednesday. It sounds like you've emailed early years with lots of questions, so please keep doing that. And again, if you have any cases, every time you get a case, please fill in the form, because that helps both ourselves and Leanne to keep up to date with what's actually happening on the ground. I think that's it from me. Amanda?
Thank you, Sonia. That's fabulous. I think the only thing for me is keep going. We know you're all tired. There's just a small team of us, and Leanne is responsible for public health across schools, early years, care homes, and any number of other organisations. If you can't get hold of us immediately, we are out there and we'll get back to you as soon as possible. And please phone the DFE about lateral flow tests and vaccines, because as much as we want to give them to you, it's not within our gift. So it's not something that we can make happen just yet, but we'll keep trying. I think that's it. Leanne, do you need to add anything else, or are we done?
That's everything from me. Just over then to say thank you, Amanda, and thank you, Sonia, for your support in pulling this together. These are going to be weekly. So if this week sort of you've not quite heard, or you have a query next week that's burning, please do use these sessions for that discussion. And yeah, let's look forward to these updates weekly.
Lovely. Thank you very much. Please send us any questions that you have prior to the meeting, because then it's quicker for us to get the answers out to you. And we'll speak to you next week. Bye-bye.